Welcome all of you to this live program at Orthopedic Principles. Today, our guest of honor is Professor Young Le Moon from Seoul, South Korea. Professor Moon is the director of the Orthopedic Hospital in Seoul, South Korea. He's a professor of Chosun University since 2010. He has been the president of the Korean Shoulder Elbow Society during 2017 to 2018. And Professor Moon is also the vice chair of the Medical 3D Applications Work Group, where he's performing the standardization of medical 3D applications. Professor Moon is a directorial committee member of the Korean Stem Cell and Regenerative Medicine Society, as well as the Korean Sports Medicine Society. If you notice, Professor Moon has delivered a lecture on our channel, which has already reached a huge audience. And today is my great honor to bring back Professor Young Le Moon for this wonderful live program. Over to you, Professor.
Thank you, Professor Hiteshi Gopalan. I am Moon from Korea. Good day, everyone. Today, I'll be discussing how recent biologic and mechanical innovation, including Regeneten, PRP, and BioRace, are transforming landscape of rotator cuff surgery, improving healing quality and clinical outcomes. Today, presentation will cover three main topics. First, I'll briefly review rotator cuff tear and repair. Second, I will discuss PRP and its clinical application. Finally, I will introduce bioinductive patches focusing on Regeneten and BioRace as the latest biologic and mechanical augmentation technologies. As people age, rotator cuff tears are becoming more common and are major source of chronic shoulder pain. Since this is the degenerative process, the damage usually worsens over time instead of healing. And in some cases, it can cause instability and arthritis in the shoulder joint. As people age, rotator cuff tears are becoming more common and major source of chronic shoulder pain. Since this is degenerative process, the damage usually worsen over time instead of healing, and in some cases, we can achieve excellent outcome through various rotator cuff repair techniques. Nevertheless, even among patients with similar condition, different levels of postoperative stability have been observed. Over time, high chance of retear 10 to 80% has remained in painful reality for both patient and shoulder surgeons. Furthermore, long recovery time after surgery remains significant challenge for both patient and surgeons. Therefore, both biologic healing and mechanical stability are essential for successful rotator cuff repair. The key requirement to emerging technology in rotator cuff tears, the key requirement for emerging technology in rotator cuff repair include stronger biologic healing at the tendon bone interface and reduction in repair site and faster overall recovery period. Therefore, several innovation solutions, including PRP, Regeneten, and BioBrace, have been developed and are now actively used in clinical practice. The first topic is PRP for cuff repair. In our hospital, we have performed around 500 cases to date. In our hospital, PRP from autologous blood, peripheral blood is combined with bone marrow aspirate concentrate, BMAC. This combination take advantage at the synergistic bioactive factors from both sources of enhanced healing. PRP enhances extracellular matrix production, neovascularization, and tendon bone healing. Since September 2022 till now, intraoperative PRP was used 500 rotator cuff repair cases. This scene demonstrates the application of first at the finally prepared PRP into rotator cuff repair site. In large rotator cuff tears, PRP significantly reduces the repair rate 4% compared to 20% in control group at 24 months. Also showed better early pain reduction and improved functional outcome reported by Pendy et al. In JSCS. For better physical stability, we injected material can also be applied in gel form. This scene demonstrates the insertion of platelet-rich fibrin gel during rotator cuff repair. According to Duncan et al., 2019, arthroscopic augmentation using 5 autologous platelet-rich fibrin gel resulted in significant pain and functional improvement at 3 months and promote faster rehabilitation. Now we'll move onto the next section, focusing on Regeneten. Between October 2024 until now, 220 cases Regeneten bioinductive patch procedures are performed in our hospital. According to Sugar et al., 2020, the Regeneten bioinductive implant showed early pain reduction from just 2 weeks after surgery, significant functional improvement, and remarkably low repair rate, 1% compared with 26% in the control group. Warren et al. 2025, the use of regeneten in full-thickness cup tear resulted in significant pain reduction, improved functional outcome, and notably low repair rate, 8% compared to 26% in control group. This is a surgical scene demonstrates the fixation process of the regenerating patch. Typically, 4 observable staples are inserted and secure the patch to the medial portion of the rotator cuff. 1, after that, 2 to 3 peak bone staples are applied to the fixed patch to the bone. Finally, additional observable staples are placed as needed for reinforcement, completing the procedure. This is 58-year-old female patient with full thickness rotator cuff tears, intraoperative finding confirmed, successfully repaired, and MRI obtained 1 week post-operatively demonstrate the tendon well covered with repair site. This is 26-year-old female patient with large rotator cuff tear. The surgical finding shows good repair, and post-operative MRI confirmed tendon coverage at the repair site. This is regenerating. Despite of being massive tear, regenerating provides strong biologic induction, allowing solid tendon integration. At 3 months post-operative MRI, we can clearly see early biologic healing with well-incorporative footprint. Even large tear can achieve successful healing with augmentation technologies. Even in 25-year-old male presenting with retail regenerative augmentation demonstrate progressively increase in tendon thickness from preoperative image into 1 week and 6-week post-operatively serial MRI scan shows gradually signal normalization, indicating not just mechanical coverage, but also the providing bioinductive healing response. Regeneten provide both biologic and mechanical advantages by inducing favorable healing environment and reinforcing the repair site. If it's not only enhance tendon integration, but also promote true regenerative remodeling. This combined effect translate into improved healing quality and consistently better clinical outcome, even in challenging cases such as massive and retailers. BioRace is expected to available in Korea starting this October 20th. This implant combined with biologic induction seen in the Regeneten and add early mechanical stability through resolvable PLLA scaffold by providing both biologic stimulation and structural reinforcement. BioBrace is designed to enhance tendon healing quality while improving initial fixation strength, particularly large compromised tears. With BioBrace, patients not only experience reduced retear, but also gain an advantage of initiating functional activity much earlier thanks to combination of biologic stimulation and early mechanical support. In summary, PRP provides early pain control and contribute to reducing retear risk. Regenerative promote biologic tendon regeneration and accelerate functional recovery. BioBrace by combining mechanical reinforcement with biologic stimulation delivers a more balanced and durable healing response. Together, these strategies reflect the evolution from simple repair to the true biologic and mechanical augmentation in rotator cuff surgery. Thank you.
Thank you, Professor. Prof, you can stop sharing.
Yes.
Yeah. Thank you, Professor, for this crisp presentation. And just a few questions, Prof. Professor, is there enough level 1 data to say that the Regentin offers superior outcomes compared to just repair alone?
Yes, it is a weak point of these studies. You are right. So it requires randomized control study for the patient. Still, lots of the institute tried such a study. So as a practitioner, I clearly bet the result would be at least better. I cannot say it would be best for the choice, but at least it could be better, more good choice than previous simple repair procedure, even though it requires quite something cost procedure.
And Professor, what is your take on PRP for a conservative treatment, not surgical treatment? If you're doing non-surgical treatment, what is your take on PRP?
Yes, the major effectiveness of PRP would be provide anti-inflammatory effect, additionally promote the vascularity and the healing mechanism. So in case of the stiffness or the minor rotator cuff tear, And if some patients do not want surgery, even there has an obvious rotator cuff tear, in such a case, only PRP injection in outpatient clinic also provides sufficient result.
Do you use in your practice PRP?
Yes, around more than several thousand cases. Yes, yes.
Okay. Professor, also, what is your take on massive rotator cuff tears? Large tears, massive tears which are irreparable. What is your solution? Or do you go for muscle transfers or do you for superior capsular reconstruction? What is your take?
Yes, in case of massive rotator or large cuff tear, I am divided into two parts. The one, patient can functionally elevate his or her arm properly. In such a case, I try to partial repair or patch graft or the repair and after that augmented with BioRace or the Regenetan. So I try to repair try to repair as much I can. If it is the patient cannot the available for abduction properly, it is persist, keep going. Maybe in such a case, I try to wait at least 1 or 2 months. If patient is still unable to moving his and her arm properly, then my comment is let's go for the reversible surgery, arthroplasty.
You prefer arthroplasty.
Yes.
And what is your take on the lower trapezius transfer? There's a lot of interest in lower trapezius. Bassam Belhassan from, I'm sure you know Belhassan. Bassam Belhassan has popularized the lower trapezius transfer, right?
I know that, but some Korean surgeon is prefer such a procedure, but some part of some surgeon clearly criticizing such something a little aggressive surgeries because the trapezius muscle is not only useful for the scapular movement, but also useful for breathing. So as the time goes by, they are going to elderly. The function of the pulmonary function is a little down. They requires the pectoralis muscle, not the back trapezius muscle also. So it's still something watching this procedure with something the anxious way.
And there are some, I'm sure Dr. Park from Korea also did the biceps tendon, right?
Yes.
Dr. Park.
Mm. Yeah, Dr. Park and Dr. Kim and lots of the doctor like this procedure with utilizing biceps rerouting. Yes.
They use
Yes.
biceps as a cable, right?
Yes, you are right. So yes, biceps is the the in aged person it is the function of flexion and extension is depend on the short head of biceps. So long head of biceps can be rerouting and reutilized as the supporting rotator cuff, the muscle, the tendons. So it is clear the smart idea rather than the trapezius transfer.
Thank you, Professor. Professor, I think that's all the questions we have for this session. Thank you for this wonderful presentation
Thank
and
you.
great discussion. Thank you so much.
Thank you. Thank you.